Hello, my name is Elinor MacFarlane and I am a PhD student at Cardiff University's School of Optometry and Vision Sciences. Patient safety in eye care is an underdeveloped field of research that has massive implications for stakeholders. For example, 3 in 4 of us will have come into contact with an optometrist over the past 2 years, but we know very little about how safe that delivery of care really is. My PhD is taking an important and novel opportunity to uncover the nature of patient safety incidents in eye care. So, in collaboration with Optometry Wales and the Welsh Optometric Committee, we aim to undertake the first characterisation of this kind in eye care in Wales involving practitioners themselves. We recruited an experienced panel of participants, with the mean number of years of practice being 17, and data collection was undertaken at this year's Welsh Optometric Committee annual conference following a presentation on recognising serious incidents in practice. We asked participants to suggest incidents that they had seen occur or could occur in optometric practice and to place them under one of these 5 incident categories, either medication, diagnosis, communication, equipment, or administration. We have a pie chart here displaying the proportions of incidents suggested under the 5 categories, and as you can see, the category with the largest number of incidents suggested was communication, and the administration category received the fewest suggestions. We then used the nominal group technique method by asking participants to vote on the suggested incidents to identify the most frequent and most severe incidents. This bar chart shows the number of votes for incidents in each of the 5 categories, with frequency votes being shown in blue and severity votes being shown in orange. There were 2 obvious categories with consensus for the votes, with the most often seen incidents in administration and the most harmful incidents in diagnosis. Unfortunately, I can't fit all of the suggested incidents on this slide, so for the purposes of this presentation, a word cloud has been generated to illustrate the diverse range of responses, with the most frequent incidents being shown here. Communication was mentioned most frequently in the responses, and this spanned across all of the incident categories. Other notable incidents suggested involved adverse reactions and drug interactions, administering the wrong drug, and similarly, referral problems or not referring, and patients being lost to follow up. Framework analysis was then used to identify themes in the data, with one of these being harm severity. We consulted with registered optometrists to provide a harm severity rating for each of the suggested incidents and charted these per category. In this chart, we can see similarities in the proportion of severe incidents as the quantitative votes had suggested, with the diagnosis category having the highest proportion of incidents that would cause severe harm. Clearly, from these data, priority targets for in-depth investigation would include diagnosis, administration, and communication. And this is a very important finding. As optometry is attempting to improve the quality of care, administration processes would be a great area for intervention to reduce the likelihood of incidents occurring. This work has already informed the development of a new incident reporting form for use in eye care in Wales, and further work will now be undertaken with incidents reported to a national database. Thanks to my supervisors, the research team named here, and KESS funding, and thank you for listening.